to talk to you today about uterine fibroids. Uterine fibroids are the most common pelvic tumor found in women. They are benign tumors. Occasionally, it can occur where a woman has cancer in the fibroid, but the fibroid is not cancerous itself. Over 90% of the time, it is benign. There are several factors that play a role in a woman's development of fibroids. Some are genetic, which cannot be controlled, although there are some environmental factors that can be controlled, such as obesity, eating red meat, drinking alcohol. Sometimes the use of oral contraceptive pills have also been associated with fibroids. The reason is not entirely clear, but it is thought that the exposure to estrogen increases the woman's risk of developing uterine fibroids. And of course, with being overweight, there's extra estrogen floating around in a woman's body. Meats are injected with estrogen before we eat them, so that's another source. And of course, oral contraceptive pills also have estrogen. The progestin-containing contraceptives, such as the IUD or Depo-Provera, don't have the same risk and may provide some protection against the formation of new fibroids. Now, fibroids are typically diagnosed with ultrasound. Three most common complaints that women complain of that make me think that fibroids are the cause are abnormal uterine bleeding. So a woman complains of heavy periods. The second one would be pelvic pain or pressure, and also fertility issues. So when a woman comes in with any of those complaints, I would perform an ultrasound, and usually what we find is fibroids. And fibroids can be located in 3 locations within the uterus, and the location of the uterus plays a role in what symptom a woman is complaining of. If a fibroid is located submucosally, meaning inside the uterus, a woman would most likely complain of either abnormal bleeding, heavier periods, or problems with fertility. So miscarriage or even difficulty becoming pregnant. Fibroids can also be located intramurally, meaning inside the wall of the uterus. Depending on the size, that woman would also complain of fertility issues and possibly pelvic pain. And then the last place they can be located is subserosally, so on the outside of the uterus. If that is the case, the woman's most likely complaint would be pelvic pain and pressure. She may also complain of urinary difficulties if the fibroid is located on the front of the uterus and pressing on the bladder. When thinking in terms of treatment for fibroids, there are 3 major things that we can do. Either expectant management, letting the fibroids run its course, see if the symptoms go away on their own. There is medical management and also surgical management. In deciding which treatment is best, the goal is to find out, 1, is the woman symptomatic? And 2, what are her fertility goals? So if a woman is nearing menopause or done with her childbearing, it's possible to do expectant management and see if those symptoms will resolve on their own once she goes into menopause, which likely they do because the estrogen is lower in a menopausal woman. Also, medical management, which would include Leuprolide, Depo-Lupron, which is the most effective medical management if a woman is wanting to preserve her fertility, or if a woman is not wanting to preserve her fertility and you want to use Lupron to lessen the size of the fibroids in preparation for surgery. Also, like stated before, the use of progestin-containing contraceptives can also be used for treatment, such as Depo-Provera, the Mirena, which is the progestin-containing IUD. The last treatment would be surgery, and there are 2 major surgeries that can be performed. Hysterectomy is definitive treatment, taking the uterus out, thereby relieving all of the symptoms, or a uterine artery embolization, which is a surgery which cuts off the blood supply to the fibroids, shrinking them in size. And that can help with someone who is wanting to also preserve her fertility. If you have any further questions, please give us a call at CWHBC. The number is 838-4472, and we'd be glad to take care of your needs.